More than 60 million people are now on Medicaid, care for the poor, and the states, which share the cost with Washington, are struggling. Chief Washington correspondent Jim Engel reports the executives in charge of the states want the Fed to give them some slack.
No matter all tell the same story on Medicaid spending.
20 years ago, it used to be about 5% of the budget, and now it's 4 times that amount. So it's a huge concern. We've got to find ways to help to reduce Medicaid spending.
The governors have lots of ideas to better manage the program, but the Obama administration bans changes without approval from Washington. Today, 29 Republican governors sent a letter to Congress urging it to establish rules in Medicaid so states can, quote, make necessary adjustments without constantly seeking permission from the federal government for changes we already know work. The policy chairman of the Republican governors puts it bluntly.
We don't think you ought to have to go kowtow in Washington. We think every state should have the right to choose to take their Medicaid money as a block grant.
Democratic governors aren't happy either. Washington State Governor Christine Gregoire, who announced today she will not seek re-election, is head of the National Governors Association. She's requesting more flexibility for her state and all others as they search for savings. The problem is that state budgets cannot run deficits, so when Medicaid costs rise, governors face painful choices.
What the Obama administration is giving us is, here is, you're going to have to raise taxes, or you're going to have to make huge spending cuts.
Whether they're going to cut education or transportation, or whether they're going to focus their cuts in Medicaid directly.
But skeptics of more flexibility argue there are few options for changes within Medicaid.
Almost 70% of its costs go to the elderly for long-term care services and the disabled.
But Barber says his state has a surefire way of saving money on precisely that, letting people avoid nursing homes by staying in their own homes with health aides paid by Medicaid.
That care costs about 1/6 as much in Mississippi, and most of the people who are appropriate for home and community-based care prefer it to being in the nursing home.
But he can't offer that without seeking a waiver. Mississippi also checks eligibility once a year, cutting down on fraud, but Washington no longer allows states to adopt that either without prior approval. In Washington, Jim Engel, Fox News.